Hello, I'm Carol, your AI-generated instructor, here to guide you through this instructional video. In this video, we will review how to feed your baby with a craniofacial condition. Having a baby born with a cleft lip, cleft palate, Pierre Robin Sequence, or a unique medical condition can bring up many concerns and questions about feeding. The Craniofacial Team at Nicklaus Children's Hospital is here to help and support you during this time. In this short video, we will show you several bottles that have been designed to help babies and families successfully feed and maintain nutrition, as well as techniques to help you feed your baby. First, our team would like to offer you support while you and your baby establish your relationship during feedings. Learning to feed is a developmental skill that improves over time. Reducing distractions during feedings will help you focus on learning your baby's cues and how they are trying to communicate with you. Babies are unique individuals and their needs must be addressed individually. If your baby has a cleft lip alone, they may be able to breastfeed directly from the breast. However, if your baby has a cleft palate, then they may not be able to create the oral seal needed for sucking and should not be expected to breastfeed directly from the breast. In such cases, you can still pump breast milk or offer formula by using a special bottle. In this video, we will review 4 types of bottles commonly used for feeding babies with craniofacial conditions. The first bottle that we will talk about is the Medela Special Needs Feeder, also known as the Haberman feeder. This bottle gives the caregiver the ability to squeeze the nipple to control the flow of milk with 3 flow levels. There are 5 parts to the special needs feeder. The soft nipple has a slit opening and is attached to a barrel-like reservoir. A white valve membrane is mounted to a disc, and these are connected to a bottle by a yellow collar. Before feeding, you must fill the nipple and the barrel. To fill the nipple, hold the bottle upright and use your fingers to squeeze the nipple and barrel. Keep squeezing firmly as you tilt the bottle upside down. Release the squeeze and milk should begin to fill the nipple. Repeat this step a few times until the nipple is full. There are 3 rates of milk flow, each represented by a line on the barrel of the nipple that show how open the slit is at the end of the nipple. The slits controls the flow rate of the milk. The shortest line means slow flow, the middle line means medium flow, and the longest line means a regular or high flow rate. Now you are ready to feed your baby. Keep in mind that the desired flow line should be aligned with your baby's nose during feeding. Positioning is the foundation in feeding your baby. Hold your baby in an upright, cradled, or side-lying position, whichever is most comfortable for you and your baby. Place the nipple into your baby's mouth with the shortest line aligned with their nose. Once your baby begins to move their tongue and jaw rhythmically, squeeze the barrel of the nipple. Follow your baby's cues, release the squeeze when the baby stops sucking, compressing on the bottle, or if they show you signs that the flow is too fast. Some of the signs the flow rate is too fast for an infant may include gulping, coughing, choking, drooling, bottle refusal, and/or falling asleep at the start of feeding. Read your baby's cues to determine which flow they handle best. Remember to change the flow by moving the lines aligned with the nose and squeezing the barrel more or less as needed. Read your baby's cues to determine which flow they handle best. You can change the flow by moving the lines aligned with the nose and squeezing the barrel more or less as needed. The next bottle we will review is the Dr. Brown's Specialty Feeding System. This bottle is designed to assist in the management and treatment of complicated oral feeding issues. The infant paced feeding valve is inserted into any level of Dr. Brown's narrow nipples to create a compression nipple which assists the infant with oral feedings. The infant paced feeding valve promotes infant-directed feedings. You do not need to squeeze this bottle. The bottle may be used in combination with any of the 8 Dr. Brown's nipple levels, as necessary to increase or decrease the nipple flow rate to meet the individual feeding needs of your baby. To assemble this bottle, first, fill the vessel of the bottle with breast milk or formula. Insert the blue infant paste feeding valve into the nipple, making sure the valve is tight and flush with the nipple base. Then insert the nipple into the collar. Be sure the nipple is pushed fully through the collar. Next, snap the reservoir onto the insert for the internal vent system. Place the internal vent system into the bottle vessel. Then place the nipple collar gently onto the bottle and screw into place. Turn the bottle upside down and milk will begin to fill the nipple. You may need to squeeze the air out of the nipple first to get the milk to fill in. After positioning your baby in an upright cradle or side-lying position, insert the nipple into their mouth as the baby begins to rhythmically compress the nipple, extracting milk. If the milk flow seems too fast, gently tip the bottle downward and remove the nipple from your baby's mouth for a suck break. This will allow your baby to swallow the milk in their mouth. Reinsert the nipple after your baby takes a breath and begins to root or turn towards the nipple. To change the flow, change the size of the nipple. The faster flow rates are numbered 1, 2, 3, and 4. The slower flow rates are T for transition, P for preemie, and ultra preemie. The Haberman and Dr. Brown special needs bottles are the most common bottles used by the Craniofacial Team to assist feeding babies with oral clefts. However, there are 2 other bottles that you may encounter and may be preferred in certain cases. The third bottle that I want to show you is the pigeon bottle. This bottle also has been designed for babies with cleft palates. It has a Y-cut silicone nipple. It's harder on one side and softer on the other side, which allows for compression of the nipple with the baby's tongue, and a one-way valve which prevents milk from flowing back into the bottle. The nipple comes in regular and small sizes. To assemble the pigeon bottle, insert the nipple into the collar. Then insert the valve into the nipple. Place the collar on top of the bottle. Close the bottle and screw the top. You are ready to feed. The tighter you close the collar on the bottle, the slower the milk will flow. The looser it is, the faster the milk will flow. Hold your baby in an upright cradled or side-lying position. Present the bottle with the thick part of the nipple up towards the palate. You will notice an air vent opening on the nipple to indicate which way is up. If the flow is too fast, you can also tilt the bottle down to decrease the flow of liquid going into the baby's mouth and wait until the mouth is clear before presenting more. The small nipple has a slower flow. The last bottle I will demonstrate is the Cleft Lip Palate Enfamil Nurser by Mead Johnson. This bottle is a relatively affordable bottle also designed to feed the child with a cleft palate. It has a flexible and squeezable bottle with an elongated cross-cut nipple. No assembly is required. To feed, squeeze the bottle with firm pressure as the baby sucks on the nipple. This bottle is a good alternative for babies who need thicker liquid consistencies for GI or safety of swallow reasons. Without a valve, a thicker liquid consistency can flow easily through the crosscut nipple, adding the benefit of squeezing the bottle as needed. Faster or slower flow depends on how much pressure you put on your squeeze and should be determined by following the baby's cues. If your baby shows challenging signs during feeding, it could mean the nipple flow may be faster or slower than what they can tolerate. If the milk flow seems too fast, gently tip the nipple downward and remove the nipple from your baby's mouth for a suck break. This will allow your baby to swallow the milk in their mouth. Remember to watch for the signs we mentioned earlier that indicate the nipple flow may be too fast for your baby. If you notice these signs, then a slower flow rate may be indicated. Slower flowing nipple levels have been shown to help babies feed more comfortably and may allow them to accept the correct amount of fluid and nutrition needed to grow, develop, and thrive. On the other hand, too slow of a flow can result in your baby getting tired during feedings, not completing their feeds, becoming irritable, losing interest, and/or not gaining weight. Milk may come out of your baby's nose because of the cleft palate. This is called nasal regurgitation. It is normal and you should not be worried. Sometimes positioning the baby in a more upright position during feeding reduces nasal regurgitation. Your baby may even sneeze during feeding. This is good as it clears the nose. Your baby may need to be burped often as they may take in more air while feeding. Look for signs of discomfort. Keep feedings up to 30 minutes or less. Longer feedings may cause your baby to work too hard and burn all those calories and nutrients that they are taking. Feeding progression is expected to advance the same as with every other baby. When your pediatrician tells you your baby is ready, spoon feeding, soft solids, and table foods can be introduced with no changes needed. Presentations of liquids will be restricted to open cup, sippy cups without valves, or any other presentations, which do not require sucking to extract the liquid until the cleft palate is repaired. When you are done feeding your baby, wash the bottle and nipples according to the manufacturer's guidelines. Just like other nipples, you should always inspect them for signs of wear or tear. Using an old nipple can be dangerous for your baby. If the nipple looks misshapen, feels soft or gummy, or has any cracks, it is time to throw it away and use a new nipple. If you intended to breastfeed your baby, but they require the assistance of one of these special bottles, please know that there are other ways you can bond with your baby. Providing your baby with skin-to-skin contact reaps multiple benefits for both baby and parents. Research has found that regular skin-to-skin contact benefits infant brain development, parental attachment, improves baby's sleep, and strengthens their immune system. In addition, for mothers, it improves breast milk production and reduces the risk of postpartum depression. If you have questions, you may contact the Craniofacial Center. For more information, don't hesitate to visit our website or consult with your child's care team. Thank you for watching this series, and remember, we are here to support you and your baby. At Nicklaus Children's is where your child matters most.